Being a physician scientist is the best career in the world. I think you get to help people in a unique way every single day. And what's cooler than that?
The Office of Physician Scientist Development, OPSD, was formed in 2018 when Dean Klotman declared that training physician scientists was one of our top priorities. Our mission is to empower physician scientists to enjoy their training, launch a successful research career, remain in the biomedical research workforce for the long haul, and ultimately train the next generation of researchers.
One of the best things about our OPSD is how incredible the leadership team is. This is a team of experienced physician scientists, very accomplished individuals who know how to do this. And their mission genuinely is to support the next generation.
Through this program, I have seen that medical innovation is another way to be just as involved in the medical field and make a great impact. The research that you're doing in these labs play a firsthand effect and translate directly to the patient. And so I want to be a physician scientist because I like being able to be creative. I like being able to think of things from a different point of view and expand my knowledge in depth on new topics.
Supporting physician scientists is a time and resource intensive process. The trainees invest a considerable amount of their time to learn the process of scientific inquiry, expand their knowledge base, and learn new technical skills. Institutions, for their part, invest in physician scientists by providing them with protected research time, strong mentoring, and funding for material resources.
Historically, we have forced physician scientists to learn job skills all by themselves, very much on-the-job training, sink or swim. We figured there's got to be a better way, and we can take all of those skills that you need to survive as a PI and run a lab and teach them to people in a didactic manner.
Physician scientists are absolutely essential to advancing medicine. The contributions that physician scientists make across the country on a daily basis have been instrumental in getting patients the care that they need. Having said that, it takes a village to raise a physician scientist. They need a lot of support. They need support in terms of having protected time away from the clinic to engage in their research. And obviously, research requires money, and it requires somebody who understands the challenges of the path.
Protected time is this coveted resource that the funding hinges on. And so getting one American Heart Association award, I think, not only allows me to be able to work with my department in terms of getting more protected time, but I think will also help support me and position me to help try to apply for other awards in a more competitive fashion.
The OPSD has really expanded my network of physician scientists and helped me connect with people in oncology, people in medicine, people in neurology, people in surgery that I might not have otherwise connected with. And so for me, the OPSD has really helped build that sense of community and that broader physician scientist network.
I love advocating for patients any way that I can. And as a physician, I can advocate for them kind of acutely when they're in the hospital, when they're in clinic, when they're in the operating room. And then as a scientist, I can advocate for them in lab through the experiments that I'm doing, the work that I'm doing. It's by far the most humbling, amazing way that you can help other people.